You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. According to my first guest, no more bleeding gums, bad breath, or loose teeth, and he uses a laser to do it, to reverse those symptoms. And with us, we have an expert on the topic. He's a periodontist, Dr. Christian Berdy. Dr. Berdy, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, for people that don't know the role of a periodontist, I guess you have kind of a progressive practice, but who is your typical patient and what are the different services you offer and do?
My typical patient is both male and female. They range anywhere from 6 years to 100 years old, and many of them come in for a cosmetic gum reshaping. Sometimes their gums have receded, so we have to go ahead and help them. We use a new technique called the pinhole technique to help them bring down the gum and make the gum and their smile look good and to get rid of sensitivity.
So people with like cold sensitivity?
Yes, absolutely.
You fix that like day one?
We can fix it. Yes, sir.
Interesting.
Yeah.
Okay.
And then we also go ahead on people who have a lot of infection in their mouth. We go ahead and treat that infection with using a laser. Sometimes we have to do other types of procedures as well. And hopefully we can help people keep their teeth for a lifetime.
Okay.
That's our goal.
Now, we're talking about gum disease today, right?
Yes.
It's not a very exciting topic to most people, but you say it is exciting,
Yeah,
right? You love it.
Yeah, I love it. And I plan to do it for another 20 years, hopefully.
So I guess there's two ways to get rid of gum disease. And first off, what defines it and what are the symptoms?
What defines it is the fact that you may have bleeding gums, you may have bad breath. I want to tell you about a patient of mine who came in, hadn't been in 20 years. You could see him from 20 feet away and know that he had periodontal disease. His breath was so bad. So sometimes it's bad breath, sometimes it's bleeding gums, sometimes it's swollen gums, sometimes there's no symptoms at all, but they were referred by a dentist who said, you have a problem, you need to take care of your problem.
I guess there's two main ways or three main ways to take care of the bleeding gums, bad breath, etc. when you have gum disease.
That's
is
correct.
To kind of cut it out, right?
That's correct.
And then there is to laser it because,
That's correct.
because
And
it's a bacterial infection.
the major way that people lose their teeth worldwide is through gum infection. That is, majority of the patient studies have shown anywhere from 50 to 70% of the population has periodontal disease, has gum infection at any particular point in time. So everybody needs to be under the care of a dentist to go ahead and really help them maintain their mouth in a good shape and to find out, do you have a problem? And the time to catch that problem is at a very early stage, Randy. The earlier, the better, because you can control things, you can help them keep their teeth. So this guy comes in, he hadn't been in 20 years, no self-esteem. His mouth is like this. He doesn't even talk because he knows he's got bad breath. He finally came in because his fellow workers told him, you've got bad breath. You have to come in and get something done. We're not going to even be in the same room with you. So here's his options. He can go ahead and have all his teeth removed, or he can keep teeth. And his teeth were very treatable for the most part. There were a few teeth we couldn't keep. I mean, they were loose. They weren't treatable anymore. There was no bone supporting those teeth anymore. But the remaining part of his teeth we could keep. We could give him a good bite that he goes ahead and has teeth that he can work with. You know, one of the problems that you have when you have no teeth, you don't know when you put food in your mouth, you don't know where it goes because there's no feedback. When you have teeth, there's feedback of where the food goes, how it's chewed, whether it's hot or cold. When you have no teeth, you don't have that feedback at all, even with the dental implants. So it's important to keep teeth. It helps keep the bone, it helps keep that. So we told him, you know, here's your options. Remove the teeth or keep the teeth. He said, I really want to keep my teeth because I had a bad experience. This is what he told me. His parents had dentures and he saw them without dentures. He saw their face collapse. When you have no teeth, your face collapses in. The amount of bone that comes with teeth disappears. And when you have no bone, you have no teeth, you have nothing. You know, their self-esteem is like this. They're talking to you like this. They're smiling like this. So what we did was we went around his mouth with the laser. We cleaned up the infection around the gums with the laser. It's very specific for killing germs. And then we did a deep cleaning at the same time, and then we go back with the laser to stimulate repair. He had amazing results. You know, when we went around with the laser, it was just phenomenal. The results were almost instantaneously.
What does it mean, results? Like, define that.
Well, when you see a new patient and their gums are swollen. They have tartar underneath the gum line. They have germs underneath the gum line. So the laser is able to kill all the germs. We go in and we clean up all the root surfaces of the teeth so they have no tartar, and then we go ahead and help them with the healing process. So when we were all through with treatment, you don't have instant results, but over time, the gums get healed, the mouth is healthy, the infection is gone, all because of the laser treatment itself. If you go anywhere else in the country, 90% of the other offices that you have treatment in will do surgery. They'll go ahead and do gum grafts, they'll cut the gums, they'll go ahead and peel back the gum, they'll clean out the infection, they'll do bone grafts, they'll add other materials in there to help the body heal. We can get the same results with no surgery, with no stitches, and very little to no pain on there. And we can do it all in one sitting. So it makes it amazing that they have this kind of results over time. Now we have this availability and we have the ability to go ahead and help people in a much less invasive procedure. You know, in all parts of dentistry, everything is changing. We're doing minimal invasive things throughout the body. You have a problem in your knee, you get minimal invasive surgery. You have a problem in your gallbladder, you have minimal invasive surgery. And now we can do it with dentistry as well. It's really phenomenal to be able to do that. Okay. Very little offices in the country do laser procedures.
So I understand this correctly. Okay, so somebody comes in. They got puffy gums, bleeding gums, bad breath, loose teeth, and maybe somebody told them their teeth may have to go, right? May have to come out. There's two choices. You go to a periodontist and they do a surgical procedure where they kind of cut back the gums, open it up, clean it out. Is that right? And you're left sometimes, I guess,
with gums that have receded. You have teeth that are much longer. You have teeth that are more sensitive. You have a much more difficult healing process afterwards.
More than 90% of the time, and probably millions of procedures every month are being done with that cutting procedure.
That's correct.
Is that true?
That's correct.
So you're saying go to a dentist that has a laser treating gum disease.
Yes, but you know, this is all we do. We're specialists. We focus just on getting the foundation back in good shape. We do this all day. This is what our training has been for many, many years. We go through a 3-year period of training just to learn about how to better maintain the mouth, how to rebuild the gums, how to rebuild the bone, and we specialize in this procedure. So I think we do it better than anybody else. And using the laser is another tool that's made it much easier for patients. We take a lot of the fear out of dentistry by doing a procedure that's very comfortable, and they are really amazed with the results that they've had.
Now, what about the downtime with the surgical procedure versus the downtime with the laser?
Surgery is done sometimes in fourths, so you have 4 sessions of surgery. By the time the patients have had their 4th session, they're basket cases. They stay away from dentistry for a long period of time, and they don't
because it's
through.
Painful?
It's painful, yes, it's painful. And with laser treatment, most of my patients are done at one sitting, the whole mouth at one time. Because if you have infection, you don't go ahead and segment that infection. You don't say, well, today we're only going to take 1/4 of your appendix out because it's infected. Next week we're going to take the other 1/4, and then 3 weeks later the 3rd, and then finally we're going to do the whole thing, and we're going to open your body 4 times. It's ridiculous, you know, to do it that way. If you have infection, treat the whole infection. You don't segment it and say, you know, we're only going to do this little piece right here today, and tomorrow we're going to do this little piece right here today.
Okay. Now the bleeding gum part. Mm-hmm. You say flossing, if you're getting blood, I mean, a little blood is okay or no blood at all?
Let me ask you, Randy, if you wash your hands and all of a sudden they start bleeding, what would you do? You'd panic.
Is that a fair comparison though?
Absolutely, because the purpose of skin is our major defense mechanism for keeping bacteria out. If there's a break in that, the bacteria can get in there. And don't forget, gum infection is infection caused by bacteria. There are 500 plus different types of bacteria in our mouth. Which one is the one that has affected you? We don't know that.
So if it's bleeding,
what does that mean? Well, first of all, you could be just flossing incorrectly. Okay? I mean, you're going like this, and that indicates to me that you're flossing. But if your mouth is bleeding, I have some patients that come in, they're eating and it starts to bleed.
But help me understand this part. So how does a laser take care of the stopping of the bleeding? That's the part I don't get.
The laser helps kill all the germs. Now, the laser doesn't stop the bleeding other than it sterilizes the space, and now we've taken advantage of your body's healing capacity. No matter what we do in the body, If you don't have healing capacity, you're not going to heal. Okay, so we take advantage of the ability, your body's ability to heal itself. And it has a wonderful capacity. If you cut your arm off here, you're not going to grow a new arm. You're not going to grow a new hand, but it will heal over here nicely if you have that capacity. The same thing happens here. If you have infection in here and you've gotten rid of the cause of the infection, then you will go ahead and have the ability to heal. So I tell my patients, I said, do an experiment with me. Wrap your arm up from here to here in a clear plastic bag. Every day you get to wash yourself real well, but you can't wash underneath the bag. At the end of the day, pick up a little corner of the bag, put a little food in there, put a few germs in there, seal it up. Do it for a month. What's going to happen? Okay? This is going to really be nasty. Okay? And so what am I going to do? I'm going to take this off. I'm going to clean it. I'm going to scrub it like crazy. And guess what happens? If that infection isn't real deep, it will heal. And this is what we do in dentistry. We take advantage of your body's capability to heal.
So the laser, targets the bacteria, kills the bacteria?
The studies have shown that it 100% kills the bacteria.
Is that right?
Yeah, 100%.
So backing up for a moment. Okay, so the guy that came in with the worst breath ever, right?
Yeah, absolutely.
Bleeding gums, loose teeth. You did the laser, went around his mouth, and the follow-up.
Well, the follow-up, he's been followed up now for a number of years. And every time he comes in, looks forward to his visits. I mean, when he first came in, you could hardly get him into the chair. And now he looks forward to coming to the dentist, knowing that he's got a good, strong bite. His teeth are firm. He doesn't have bad breath. His demeanor is completely different. When you look at him, he's got self-esteem. He dresses better. He looks forward to giving our hygienist a hug. And it's just a wonderful visit.
So if everything works out, somebody comes in with bleeding gums, bad breath, loose teeth, etc., and they don't want the surgery, you say go around the mouth with a laser. Maybe I'm simplifying this, but you do go around the mouth with a laser.
We go around with the mouth.
Kill the bacteria, right?
That's right.
How soon do those symptoms go away?
When they come back in 2 weeks, it's absolutely amazing. Some patients have been away for 20 years. They come back 2 weeks later. It's like an absolute transformation. The mouth is healthy, and they're getting back to a wonderful
What
smile.
do they say? What do they say?
I said, I can't believe the results. I had no pain. I hardly took any pain medication. Most of the time, I just give them a prescription for Tylenol, plain old medication, no narcotics afterwards. It's amazing how little pain people have after they've been treated correctly.
So when I go to your website and I see a button that says no cut, no sew.
What that really means is that we don't make any incisions between the gum and tooth. In 90% of the country, you're going to have a procedure done where the gums are reflected, the infection's removed, bone grafts are done, chemicals are added to add things done. Here in Jacksonville, I use the laser to go ahead and clean up the infection. It's amazing the results that we have with this.
In Jacksonville, right?
That's correct.
Would you say that the old way to treat gum disease of cutting and then sewing up the gums, bone grafting, et cetera, is being done every day, somewhere? Some office?
Oh, yes.
Like 5 a day, 10 a day?
I have no idea how many times a day.
But several times a day?
More than 5 a day, I'm sure.
Okay. And are you saying that 99% of those people, in your opinion, could be taken care of with a laser instead?
Oh, absolutely.
Really?
Every one of them could be taken care of with a laser. The surgery really is the treatment of least desirable. I mean, if I'm the patient, I don't want to have surgery. And I treat my patients like it's me. I look at them and I say, what do you want to do? I say, I want to keep my teeth. I say, well, these are your options that you have. We can help you by using the laser to clean up the infection around your gums. And you will have some good results with that.
Good. Now you say, and by the way, you've been using lasers for 25 years.
That's correct.
So lasers in dentistry were around 25 years ago?
That's right. Yeah, they've been around for a long, long time. This is we've gone through an evolution. As new things come around, they're improved upon over time. And the protocol that we now use is called LANAP, which stands for Laser Assisted New Attachment Procedure. And it's been developed by one company, and they have a patent on the process. So you have to take their course. There's an investment of time and money to go ahead and do that. But the results are so good that if you don't do this type of procedure, you're really hurting your patients more than helping them.
So you love this?
Oh, I love it.
Go ahead.
If I had gum problems, I would go to a friend who uses the laser, and a periodontal friend as well.
As a periodontist,
Yes.
you were trained in this pocket reduction surgery.
Correct.
Is that what it's called?
Yeah,
What's
well,
it called?
Really the whole purpose is to clean up the infection and to give the patients the ability to clean their teeth. If you have a pocket, what a pocket it really is, let me go through that because I didn't explain to you what a pocket is. When we examine a mouth, we look to see if the gum is healthy. When we have an area where there's been infection, the gum has receded away from the tooth. It hasn't physically dropped down at this point, but the infection has destroyed the gum and tooth attachment. As this infection progresses, it starts destroying the bone that supports the teeth.
So around the tooth, the gums are kind of moving away.
They're moving away.
So when I'm at a hygienist and they're saying those numbers on each tooth, like 2, 3, 4, whatever.
Yeah,
that's a pocket.
That's an area where infection. Okay. Well, a pocket is an area where there's no attachment against the tooth, and the higher the number, the deeper the pocket.
Okay.
Okay. So if you have a pocket that's very deep, germs can get in there, bacteria can get in there. There's no way for you to clean that, Randy. How are you going to clean up underneath the gum line? When it gets up, it's just like around here, this collar here. If I can't get anything in there, how am I going to clean the germs out from that area? So we call this a pocket, and as a pocket progresses, it continues to destroy the bone that supports the tooth.
Again, how they take care of this is they'll go to a periodontist. The periodontist kind of cuts some of the gum tissue out.
That's correct.
Is that right?
Yeah, they cut the gum tissue away. Sometimes they reshape the bone. Sometimes we'll do a procedure to build bone back with bone grafting. And then we go ahead and suture everything back together again, and it's always at a lower level. So now we have more tooth exposed.
Like long-looking teeth?
Yeah, you've heard the expression, long in the tooth. Well, you could be long in the tooth or no longer have teeth.
So instead, just go around the mouth with a laser.
So the laser eliminates the fact that we've got to make an incision between the gum and tooth.
And then the gums, what, grab onto the tooth again?
No, the gums heal from underneath. The body brings in new cells in there to repair. It brings in new bone to repair, and then the gums reattach again against the teeth. You will have some shrinkage in some areas because there's just so much that the body will rebuild. But it will do a good job of rebuilding itself if everything's correct. Don't forget, if patients have diabetes, if they're on medications, all these things will contribute to the problems that they have. Some people have a hereditary problem with their mouth as well. We have some patients that have aggressive periodontal disease and it can attack them at a very early age. I had a gal, she was 17 years old when she came in. Beautiful girl. You looked at her teeth, her front teeth were already loose. They were wiggling in her mouth, and it was really a shame. She would have to lose her teeth at age 17. Now, I have children, and if they had to lose their teeth at that age, they would be devastated. I would be devastated. And here she is, an attractive girl, and so we treated her with laser. Amazing results.
So really, it was just an infection?
She had, part of hers was hereditary as well, but basically it's an infection. So she comes back after treatment, and her mouth is so much healthier. The gums have started to tighten up against the teeth. The teeth now are firm. She now can go ahead and bite into an apple. One of the things I ask them, how do you eat? Well, I ask them, how do you bite into an apple? How do you chew an apple? If I give you an apple, how would you eat that apple? A lot of them tell me, well, I cut it up. I say, why is that? Well, it's because my teeth are loose, and I'm afraid that if I bite too hard, I may lose that tooth. So now she's able to eat again. She's able to go ahead and smile again because she was afraid before her teeth were literally going to fall out. Now, can you imagine age 17 and what your peer pressure was going to do for you at that point in time? It's amazing results.
So her scenario, 40s, 50s, 70s, 80s, it still applies. You go around the laser and the teeth get stronger, right?
The teeth don't get stronger, the bone gets healthier, and now the teeth get firm.
Because the gums grab onto it?
Because the gums grab onto it and the body rebuilds the bone to help support the teeth.
Why aren't all periodontists doing it this way? That means why are they all cutting it out rather than treating it like an infection?
They still don't believe that the results are there. They need to see study after study after study about all of this. And the studies are there. They're just not looking at them correctly. They don't want to take the time to learn the technique, to get the equipment that's necessary. And in most dental schools, laser treatment is not taught. And that's the bad part.
Is this less expensive than the cutting method for patients?
Oh, yeah. It's less expensive from a time management point of view, from a dollar cost management point of view, and from a health point of view. They're taking much less time off. They have no pain afterwards. They don't have to take medications. And it's just a wonderful procedure that can be done for them.
Is the future of dentistry where people, go in and every dentist will have a laser and go around the mouth and kind of at different, I guess, wavelengths to clean up the mouth with a laser?
I think so.
Like whether it's 20 years or 50 years or whatever from now?
Absolutely. The future of dentistry is lasers. The research that's being done throughout the world with lasers is just phenomenal. And it really, anywhere in the body, it's wonderful. In the mouth, it's phenomenal.
And you say you're changing people's lives, transforming their lives in one day.
Absolutely. I have one patient who came in their 40s, had a lot of infection throughout their mouth. And we went ahead and did treatment on them, and within a short period of time, they've healed up, and they're a new person. They now have invited their spouse to come in and have treatment as well, because they both knew they had a problem. A lot of times patients stay away from dentistry for a long, long period of time. Sometimes it's money, sometimes it's fear of dentistry, sometimes it's being embarrassed about the fact that they've got a problem. Sometimes they've had bad experiences in the dental office. So these are all reasons why people stay away from dentistry, and now they're being transformed. They realize that if I get my mouth healthy, now I have a lot more energy. Some of these patients have come in. I had one patient who came in, I asked him, how do you feel? Well, I'm run down. I just don't feel good. I'm lethargic. So we had them go through to their physician, get all sorts of physicals done, and everything was healthy. But now we got their gums back in good shape, and they came back energy like crazy. So what did? They bring their spouse in.
So you say they have more energy. Is it because when you have an infection, I guess that robs you of your energy?
Oh, absolutely.
You take care of the infection, and now they have more energy? Is that what you're saying?
Absolutely. They're like a new person. They're transformed. The body takes a lot of energy to go ahead and fight infection. Infection is such that the body, if they have no treatment, the body's going to try to maintain that infection in an area. So you'll have swelling in the mouth. Tooth is gone. Now the infection goes away. In periodontal disease, the whole body is trying to go ahead and support itself and keeping that infection at bay and using a lot of energy. And all of a sudden now, the need for all that energy is no longer there.
Have you actually had a patient say, I have more energy now?
I have had a huge amount of patients say that. Just because they've come in, they've been afraid of going to the dentist. They've stayed away for years. That's my favorite patient because I know I can help them. And these are the type of patients that I like to see because I know I can get good results for them.
Have you ever had people that were told elsewhere that their teeth had to be extracted and somehow they end up in your lap and you've saved the teeth by just getting rid of the infection?
Randy, I had this one lady who was told, she's 90 years old. She was told she had to have her teeth taken out and had to have dentures placed. Now, she's very alert. She's with it. She's a wonderful lady. We did treatment on her. She still has her teeth. She was able to keep her teeth. And she is so happy that she still has teeth and doesn't have to have dentures like the other people in her nursing home.
Okay, good.
Yeah.
Now, we have a video that shows, it's an animation of this laser. So what are we about to look at?
So we're going to look at how the laser is actually used, how it works within the pocket. The laser is a very thin, the way the laser energy is delivered, it's a light energy that's delivered within the pocket itself, within the gum tissue, and it's delivered by a very thin fiber that's about the width of 3 hairs. And after it's placed in there, the infection is removed, and then we do a deep cleaning. So this is what it's going to show.
Let's take a look.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Very interesting. Okay, so the laser just goes in,
Cleans up the
area.
infection. Yeah, cleans up the infection. We go in with our instruments and clean up the root surface so that there's no residual bacteria on the roots themselves. And then we go back, as you saw in the little video, that we seal the area, we form a clot that now all the healing comes in from that clot.
Okay, so no more bleeding gums, bad breath, loose teeth. Go in, get it lasered, and those symptoms go away.
Absolutely.
So you're a periodontist. Does it cost more to go to a specialist?
No, sometimes it's even less. We've done a survey of some of our fees around our area, and we found that what we do is actually sometimes less expensive.
Now, general dentists can have these lasers too.
That's correct.
Is that true?
Yes.
Do you have a bias? Do you believe that they should
No, I think,
see a periodontist if they have a choice?
Absolutely, because that's all we do. We do gum treatments. We've done that for a long, long period of time. We've had special training to go ahead and do that. You can't learn these things on an overnight, over the weekend type of course. It takes years to go ahead and really learn about the foundation of the teeth. So general dentists have a good knowledge of everything. They do a wonderful job. They're part of our team. We partner with a lot of general dentists to go ahead and help them get their patients back in good shape. So we want to make sure that we include them as part of the team as well.
Good, good.
Yeah.
As a final message, and I don't want to put words in your mouth, but this is what I'm picking up, that if you have loose teeth, bad breath, if you have a gum disease, it's a bacterial infection.
Correct.
Okay, so their dentist can go in and cut it out, or at least cut back the gums, pull them back, and then sew them back on. But still, they've got to, even though they're deep cleaning, they've got to be leaving bacteria behind, right?
That's correct. They don't eliminate all the bacteria.
So the second way to do it is go to a laser dentist or go to a periodontist that has a laser, one of these LANAP protocols, and go around the mouth with a laser, kill the bacteria, gums get healthier, teeth
That's
get
correct.
stronger, even some of the bone grows, you say.
That's correct.
So logically, it makes sense.
Yeah, absolutely. Don't
If
forget,
it's true, why would anybody do it the other way?
they shouldn't. They should come to me.
I want to thank you for coming on the show. We have, asked you, seriously, to get on the show for 7 years.
That's correct.
I know you're in Jacksonville, we're in California, and we did some begging, and so thank you so much. But you are one of the most experienced guys in the country or the world when it comes to this.
The laser dentistry for gum treatments, yes, sir.
Yeah, good for you. All right, we didn't talk a lot about your background, but periodontist, and so if you have bleeding gums, bad breath, just call you. Free consultations?
Correct.
All right, thanks. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.